parents find out they're having a baby, they usually have a ton of questions. So maternal-fetal specialist Dr. Klein is here with some answers. So what are the biggest birth myths that you hear about?
You know, one of the things that I think people don't quite know what to expect is that often when a woman comes in labor, her family wants to know, what time is the baby going to be born? And that's an answer that none of us can give them. There's really such a wide range of what's normal. The first stage of labor, when the cervix is dilating, it can last anywhere from a couple of hours to several days. And then the second stage of labor, when the woman's pushing, that can be anywhere from 5 minutes up to 3 hours, and all of that is considered normal. As long as the baby is healthy and doing fine, we're really trying now to be a little more patient and allow time for labor to progress. That's because we're a little concerned about the rising rate of C-sections in the U.S. And so are trying to not rush to do a C-section if labor is progressing slowly.
So how crucial is this birth plan that everybody works so hard on?
So birth plans are things that pregnant women work on to sort of determine how do they want their labor to go. Are they planning to get an epidural or any pain medicine? Do they want to be able to walk around while they're in labor? And I think it's fine to think about those things, but I really tell my patients not to be too rigid about that, to have an open mind and be flexible, because even in a normal, healthy pregnancy, things can change during labor pretty quickly. And the obstetric team, the doctors and nurses, really our goal is to have a healthy mother and a healthy baby. And so if we need to change the birth plan a little bit to achieve those things, that's what we want to do.
Okay, and does spicy food, does that really induce labor?
No.
What about sex? Everybody says sex does it too.
So there's some biological plausibility to that, because there's some prostaglandins that might stimulate the cervix. It hasn't been proven. You know, the one method that really has been proven to promote labor is something called membrane stripping or sweeping. That's something that the OB doctor can do in the office to help you increase the chances of going into labor.
Well, moms are probably ready to try anything when they're really ready.
They may be.
What about eating and drinking? A lot of women, they're just chewing on ice. Are you not supposed to have any food?
So during labor, we usually limit it to clear liquids like apple juice. That's one of the things we brought. So even as I said, in a kind of a normal pregnancy, there's always a risk of needing an emergency C-section. If that happens, you really want the mother's stomach as empty as possible to reduce the risk of any complications with surgery. Labor often involves vomiting as well, and so the less that's in there, the better.
Yeah, all right, that's very pleasant. Well, thank you so much for being here. And you guys have all kinds of resources at Memorial Hospital. There's classes for expectant parents, and you can go to their website for more information. They also have a nurse line to call, and the number is on your screen. Thank you so much for being here.
Oh, thank you for having me. I appreciate it.